Hello everyone, we welcome you back to our YouTube channel. Today we'll be discussing about pediatric nursing part 4. The first question is, which of the following signs and symptoms would observe in a child diagnosed with laryngotracheal bronchitis? Option A, predominant stridor on inspiration. Option B, predominant expiratory wheeze. Option C, high fever. Option D, slow respiratory rate. The correct answer here is A, predominant stridor on inspiration. If you have watched our previous video, pediatric nursing part 3, we have already discussed in brief about laryngotracheal bronchitis, which is also known as croup, C-R-O-U-P, croup. So croup, it is a respiratory infection which is caused by a virus, and the main sign and symptom of croup are the following: barking cough, B, noisy sound when breathing in, that is stridor, fast and labored breathing, cold symptoms, that is mild fevers or running nose. So as you can see here from the following four options, predominant stridor on inspiration, which is a correct answer. Wheezing is not present in group, and high fever, there is only a mild fever in group, whereas there is a fast and labored breathing, and the option given in this question is low respiratory rate, but in group fast and labored breathing, that is high respiratory rate is present. So next question is, a newborn failure to pass meconium within the first 24 hours after birth may indicate which of the following? Option A, H-Sprung disease. Option B, celiac disease. Option C, intussusception. Option D, abdominal wall defect. Correct answer here is A, H-Sprung disease indicates that a newborn failure to pass meconium within the first 24 hours of life. So the correct answer here is A. Next question. Which type of esophageal atresia with tracheoesophageal fistula TEF is known as H-type fistula? Option A, type 4. Option B, type 5. Option C, type 1. Option D, type 2. The correct answer here is B, type 5. We'll be discussing in brief about the TEF and from type 1 till type 5. The correct answer is B, type 5. Esophageal atresia, it is a congenital absence of continuous passage of esophagus from pharynx to the stomach. As you can see here in figure A, this orange color is esophagus, whereas the light pink color with the ring light is a trachea. So in the type A, there is a discontinuous passage of a esophagus. As you can see, there is no connection between the proximal and distal part of the esophagus. That is called esophageal atresia. Whereas in type B, there is a TEF, that is tracheoesophageal fistula. There is abnormal opening between the proximal part of the esophagus with the trachea. And the option C, which is 86%, which is a common type of TEF. Question might come, which of the following is a common type of TEF? Remember that is type C. That is, in type C, the proximal the distal part of the esophagus is connected directly to the trachea. The distal part, not the proximal. Whereas in type D, which is also known as type 5, type A or type 1, B or type 2, C type 3, D or type 4, E is type 5. In type D, you can see both the distal and proximal part of the esophagus is connected to the to the trachea. And type E, which is also type 5, it is directly connected, both the upper and the lower part of the esophagus connected to each other and again connected to the trachea, which is is similar to the letter H. That's why it's called a H-type fistula. So the correct answer here is B. Next question. Which of the following surgical procedure is not used in the correction of Hirschsprung disease? Option A, Duhamel's procedure, A, Swenson procedure, C, Ramstedt procedure, D, Soft procedure. Correct answer here is C, Ramstedt procedure. Why? Because Ramstedt procedure is not used in the surgical procedure of Hirschsprung disease. It is used for pyloric stenosis. We'll be discussing in brief about this. As you can see here, the surgery performed for a Hirschsprung disease is Swenson procedure. We'll just mention the name of procedure. In details, you can always refer to books or internet sources. Duhamel procedure, Soft procedure, and Reben, and that is an outdated procedure. So the main three procedure surgical intervention for this Hirschsprung disease is Swenson's procedure, Duhamel procedure, and Soft procedure. Whereas the Ramstedt procedure, which is also known as pyloromyotomy, it is used to treat pyloric stenosis. The surgeon makes an incision in the wall of the pylorus. It's also this pyloromyotomy, also known as threaded Ramstedt procedure or simply Ramstedt procedure. That's why the correct answer here is C, Ramstedt procedure. It's not done in case of Hirschsprung disease. Next question. The posterior fontanel measures about at birth. Measurement of a posterior fontanel at birth. Option A, 5 into 5 cm. Option B, 1:1 cm. Option C, 3.5 into 3.5 cm. Option D, 2.5 into 2.5 cm. The correct answer here is B, 1.1 cm is the measures of the posterior fontanel at birth. As we all know, this there are 6 fontanels at birth, out of which 2 are of obstetrics importance. Those 2 are anterior fontanels and the posterior fontanels. Anterior fontanels, also known as Bgimer, is also commonly asked questions, and it is closed at 1.5 year, whereas posterior fontanel is also known as lambda, is closed at 1.5 month, that is 6 weeks. Anterior fontanel is formed at the junction of sagittal, coronal, and frontal sutures, whereas the posterior fontanel is situated at the junction of the lambdoid suture and sagittal suture. Next question. Amount of oxygen administered to infants by nasal catheter per minute. Option A, 4 liters. Option B, 5 liters. Option C, 2.5 liters. Option D, 1 liters. The correct answer here is D. 1 liters is the amount of oxygen administered to infants by nasal catheter. Next question. A child can copy a circle at what age the child can draw a circle? Option A, 2 years. Option B, 1.5 years. Option C, 4 years. Option D, 3 years. Correct answer here is 3. The child can copy a circle at 3 years. 4 years, a child can draw a square, and 2 years, a child can draw a vertical or a horizontal line. So correct answer here is 3. Horizontal or vertical line at 2 years, circle 3 years, square at 4 years. This is also very commonly asked questions. A child grabs fingers when palm touch occurs at the age of A, 4 months, B, 6 months, C, 9 months, D, 3 months. The correct answer here is D, 3 months. A child grabs fingers when palm touch occurs at the age of 3 months. This is a motor development in infants, which is also favorite color of most the examiner. So grabs reflex, it disappears The grasp reflex disappears around 3 months of age. It means touch of palm of hand of infant and flexion occurs. Prehension, it occurs around 5 to 6 months of age. It means grabs objects between fingers and opposing thumb. Example, a baby can hold drinking cup. Next reflex is parachute reflex. It appears around 7 to 9 months as a protective arm mechanism. It means when infant is suddenly thrust downward when prone. Pincer grabs is well established by 1 year of age. It means coordination of index finger and thumb. So the correct answer here is 3 months. Child grabs fingers when palm touch occurs at the age of 3 months. During physical assessment of children, asymmetry of the skull indicates option A, hydrocephalus, option B, craniotapes, option C, craniosynostosis, option D, osteogenesis imperfecta. The correct answer here is C, craniosynostosis. During the physical assessment of children, asymmetry of the skull indicates craniosynostosis. In craniosynostosis, one or more sutures are closed early. The skull then attempts to grow parallel to the fuse. The sutures, instead of being perpendicular to it, cause an abnormal shape of the head. Next question. A positive Babinski sign is present in infants until approximately what age? Option A, 1 year, B, 2 years, C, 3 years, D, 5 years. The correct answer is here. Positive Babinski sign is present in infants until 1 year. Positive Babinski sign is normal in neonates but abnormal in adults. This is it for today. Thank you for watching and kindly share and subscribe.